I'll tell you one piece of science and then maybe one theory that's relevant to all of us and even tonight. The piece of science, which is prevention, but it's after diagnosis. And I just want everybody to know it. There's a very well-known physician in San Francisco, Dr. Dean Ornish, 63 years old, who got very interested in preventing and reversing heart disease in his early 20s. Medical degree, Harvard trained, San Francisco trained. And he identified, and some of you may know the name, some of you may not, as early as the late 70s, early 80s in publications in the finest journals. I happened to read his work early in my career, which was transformative, that you can take very bad heart disease, and if you take away animal products, put in plant-based products, manage stress. He taught people how to meditate and do yoga, do some walking, and don't smoke. He documented you could reverse heart disease. It's actually a Medicare-approved program now. The science has become so strong since he developed that for heart disease. What's fascinating, though, is frankly, and he's become a friend, is he got bored with dealing with heart patients. And he was able to get a guy named Peter Carroll, the head of urology at University of California, San Francisco, to give him 100 prostate cancer patients that were going to be watchful waiting. They weren't going right to the OR, right to radiation. And half of them, he said, just follow your urology plan. I'll see you in a year. Half of them, he said, come visit my cardiology clinic. We're going to teach you how to eat different, walk different, stress different, don't smoke, and have some social support. Within 3 months, PSA, the marker in the blood, was going down with lifestyle change. It was going up in watchful waiting. He actually took the blood of these people now eating broccoli and carrots and celery and, casseroles, but not dairy, beef, or eggs. And he took the blood and dripped them with coworkers on prostate cancer cells. The blood of people that had changed their diet was 8 times more potent at killing prostate cancer cells than the control blood. And at the end of the year, he demonstrated that a significant number in the control group had converted over to needing a surgery or radiation for their prostate cancer due to documented growth. 0 in his group did. So that was 2005, published in the Journal of Urology, which is a well-known journal. He's gone on to follow these people and all. He's never written a book on the topic, but if you have prostate cancer, I tell my patients, Google Dr. Ornish, O-R-N-I-S-H, Google prostate cancer. You can read about it on your own. I mean, I brought the article, and there's several that have followed up. Now, in terms of preventing it, because that's more a treatment arm of watchful waiting plus lifestyle, there seems to be the highest population. Why is cancer up 33%, as Dr. Lutz said? There's something about diet, lack of exercise, obesity in our environment. The highest risk group are inner city black men for prostate cancer, and they probably have no category that's definite, but the worst diet, the least exercise, the most obesity, and probably the most pollution and exposure to toxins and plastics and environmental things. So I can't prove it, and nobody can, but I would urge people to be very careful of all the things that I teach patients. Don't microwave in plastic. Be careful about plastic water bottles. Be careful about drinking coffee in styrofoam cups like we have tonight. I wouldn't do it. I'm a coffee freak, but not in styrofoam cups. Learn to be careful about your environment and start to make a few simple changes. And we don't know for sure that prevents prostate cancer, but when you ask why is it rocketing prostate and other cancers, we aren't different human beings genetically, but we have a very different world where food, environment, stress, electronic, Wi-Fi and all. I don't put my cell phone by my brain, but I don't put it by my private parts either out of just some general concern. So the best preventive piece of data I have is that men that ejaculate more than 21 times a month have decreased prostate cancer. So there is science that you can use and smile about, and if we can only get the women on board with that. Amen. 21. That actually is science-based. Thank you.